quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30-plus lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30-plus lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Welcome to Redefining Medicine, and welcome to Las Vegas to Longevity Fest 2022. It's A4M's 30 Years of Medicine Redefined. And we have with us Dr. Tom O'Brien right now, who has just gotten off stage giving a talk about, tell us, Dr. O'Brien, and thank you so much for joining us.
Well, thank you. The talk was on biomarkers of brain inflammation.
Mm-hmm.
And so I'll just do a few bullet points if I can.
Please do.
14 of the top 15 causes of death, according to the CDC, are chronic inflammatory diseases. The only one that's not is unintentional injuries, accidents. Everything else is chronic inflammation. And we all know that, and we think we're dealing with inflammation, but are we measuring biomarkers of inflammation and then checking to confirm that we've done the job?
So what do you mean by that?
Biomarkers? Are we doing tests to measure immune system activation?
Okay.
Are we looking at antibody levels? Are we looking at cytokine levels? And as a clinician, most of us say, that's not so important.
It is important.
It's primary.
Yeah.
14 of the top 15 causes of death is that you're inflamed chronically long term.
Right.
So maybe you get the patient to lose weight with your gluten-free, dairy-free program. Their belt comes a notch tighter. They're happy. Their energy's up. But they don't know, the patients don't know that they're still inflamed. They may be less inflamed because they're gluten-free now as an example, but they're still inflamed. The example of that, Sweden has socialized medicine. They have records on everybody, right?
Right.
So they looked at 350,000 patients that went for endoscopy and biopsy. So here's a patient who went to their practitioner, who referred them to a gastroenterologist, who referred them for endoscopy biopsy, 350,000 people. They found 39,000 celiacs. The rest, colitis, Crohn's, normal, but 39,000 celiacs. They followed them for 25 to 30 years. If you were diagnosed with celiac, you had an 86% risk of dying within 1 year of a cardiovascular incident compared to the other 300,000 people that had endoscopy. 86%. And a 3.87-fold, almost 400% increased risk of dying from a cancer within the first year after diagnosis compared to the other 300,000 people. This is in JAMA. It's the largest study on mortality in celiac disease ever done. And you look and you go, what? What? So you put somebody on a gluten-free diet because they're a celiac and they lose weight, their belt comes 2 notches tighter, they feel better, their kids asthma's gone. You get all the results. Their husband's arthritis is gone, and he's exercising again, losing weight. And 9 months later, their husband dies of a heart attack. You say, oh, that's too bad. And you don't realize that your diagnosing celiac probably initiated the mechanism that caused the increased risk of death.
You want to elaborate?
I'm going to elaborate. When you go on a gluten-free diet, they took 10 people, this is in British Medical Journal, they took 10 healthy subjects, average age 30, and no diagnosis of anything. They did microbiome analysis. They put them on gluten-free diets for 30 days and did another microbiome analysis. Every single person, their probiotics diminished, the beneficial probiotics diminished, the pathogens increased, and the diversity went down dramatically in 10 out of 10 people. You put people on a gluten-free diet, their microbiome gets worse if you don't know how to do it properly. So everybody does these gluten-free garbage products, the pastas and the cookies.
They have more chemicals in them than anything else.
Yeah, and the real kicker to that is that 80% of the prebiotic in the Western diet is the arabinoxylans of wheat.
Right.
So you put them on a wheat-free diet, you give them this white paste, this garbage pasta, and a blueberry muffin at Starbucks. It's healthy for me. Oh, I can have two. No, it's not healthy. It's just not as toxic for you. Now, I love blueberry muffins.
Maybe it's just capitalizing on the gluten-free craze.
Exactly. That's all it is. Now, and I'm half Italian. I'm going to eat pasta every once in a while.
When you go to Italy, you should. Not here.
I lived in Italy for a few years. We just recently, and they've got great gluten-free pastas in most of the restaurants.
True, but that's a lot more pure.
But it's garbage food. It's just garbage
right.
food. Do you hear me? It's garbage food. And you alter the microbiome to a more pathogenic microbiome.
Right.
People don't like to hear this. They don't like, but read the science. And I'm I've been talking about gluten since 2004.
You're a little passionate
I'm a
about
little
it.
passionate about it because people die. People die.
So what do you recommend what should they do?
You have to replace the prebiotics in the diet. So my recommendation, Mrs. Patient, when you go shopping, and you're buying your vegetables, always buy organic, and there's many reasons why.
But give some reasons. Don't just brush over.
Okay, after. But
no, give it now.
Okay. In JAMA, they did a study, and the editors wrote in the study, this is an elegant study using sophisticated biomarkers to prove their point. When do you see the editors of JAMA giving a stamp of approval to an article like that in the comments section? That doesn't happen very often. So I thought, whoa, I need to read this one. And so this is on a different topic than what we're talking about, but you asked to go there. So these are couples that went to assisted fertility centers, which is very big business now, right?
Huge.
And they ruled out all of the other factors that may contribute to success or not, and they did it in an elegant way, which is why the editor said this is an elegant study. And they ruled it down to organic or inorganic and the amount of fruits and vegetables per day. And they divided them into quartiles. And they took the highest quartile of organic fruits and vegetables compared to the highest quartile of inorganic fruits and vegetables. What they found was the highest quartile of inorganic fruits and vegetables, they're eating, and it was 2.7 servings a day, which is nothing. But that's the highest quartile for these couples that were going to assisted fertility center. These are 20-somethings and 30-somethings and don't know how to choose food properly, right? Because they've grown up not being taught how to do this.
McDonald's.
That's why we all need nutritionists, health coaches, registered dietitians in our practice who are trained in how to guide people properly. Because doctors don't have time to do this.
We do have to train our doctors. They need to learn.
Well, they need
suffer.
to understand the principles,
They
but
suffer.
they can't take the questions on what do I cook for dinner. They don't have time. So you hire a professional who's well trained in that, right? That's my opinion. So what were the results? If they were in the highest quartile of inorganic fruits and vegetables per day, they had an 18% less likelihood of success in getting pregnant. 18% less. And, this is the kicker, a 26% less likelihood of a live birth.
Wow. That's serious.
Babies are dying because they're eating lots of fruits and vegetables, but they're inorganic. It's all the chemicals. You want an example of why you have to buy organic? That's why. And it's not just for your reproductive system. It's every system. You just read the science. And wow, I didn't know that. It's okay, you didn't know. Now you know, right? And so, wake up. Wake up to this, because this is what's killing our people, our patients, is they don't know. 14 of the top 15 causes of death are chronic inflammatory diseases, right? So what do I tell for patients when they go gluten-free to minimize this increased risk of death?
Right.
When you go shopping and you buy your vegetables, always organic, that's why. And buy a couple of every root vegetable in the store. Rutabagas, turnips, parsnips, radishes, carrots, sweet potatoes. Not so many white potatoes because of glycemic index, the impact factor of white potatoes, but all the others, and you and your family have one root vegetable a day. Well, I don't know what to do with a turnip. Well, neither do I.
Boil it.
But what I do is I slice an onion, I dice up the turnip, I saute them with a little garlic, a little coconut oil or avocado oil, cook it till it's soft. I add a sauce to it, peanut sauce or something, and I eat it.
That sounds good.
Well, what about parsnips? I slice an onion, peel
Same
some
thing.
garlic, dice the parsnip, saute it up, add some sauce to it, and I eat it. You don't have to be Julia Child. You just have to get it down. It's because the root vegetables are the fibers that feed the probiotic bacteria in your gut. And when you take gluten out of the diet, which is a really good thing to do, you alter the microbiome, and it just depends how you're going to alter it, because you're removing 80% of the food of the probiotics that the patient has in their gut. You're removing that food and you're supplying it, you're replacing it with white paste, which is garbage. Garbage. So what happens? The probiotics die off. Just read the science on that. When you read it, it's like, oh my God, I didn't know this. Well, now you know, right? And so one root vegetable a day, and you go on Google, you type in list of prebiotic foods, have the patient print it out, put it on the refrigerator, or make a handout for them, and put it on the refrigerator, and every day you eat 2 from the list, and you learn that a banana's a prebiotic, garlic's a prebiotic, onion's a prebiotic. You don't have to eat chicory. You can if you like, but you don't have to eat these weird things to get prebiotic value. Right? There's a whole list of things that are everyday foods. But 1 root vegetable a day and 2 from the list. The next thing you do to rebuild a healthy microbiome, I didn't think we were going to talk about this because that's not what I talked about today, but we're on a roll.
You're good.
We're on a roll.
You're doing well.
The next thing is, Mrs. Patient, get 5 different types of fermented vegetables.
Right.
Get sauerkraut,
Kimchi.
miso, fermented beets, curry flavored, whatever you like. And every day you work up to, some people can only have a tiny little bit at first, they have to build up tolerance, but you work up to a tablespoon a day of fermented vegetables because you're inoculating the gut with the probiotics. And when you do get up to a tablespoon a day, you're increasing the probiotics in the diet by 10,000-fold. So you read the papers on this and you go, wow, I didn't know that. And it's so easy to do. And some people, and the kids don't like fermented foods, so you take some of the juice out of the sauerkraut and you put it in the salad dressing, their ranch dressing, their ranch salad dressing. My kids wouldn't eat kale unless they drowned it in ranch dressing growing up, so you figure out a way to do it. But you don't have to taste it, and to avoid the histamine reaction, it's best not to taste it. Just get it down to the gut to inoculate. Next, Mrs. Patient, 1 cup a day when you are transitioning, and 1 cup every couple of days to a week later of bone broth, organic bone broth. Bone broth is high in gelatin tannate. Gelatin tannate acts as a seal on the leaky gut so that it puts a seal over it so that the cells can reproduce and they're not, it's like if you get a carpet burn on your knee, you slide on and you get a carpet burn, you can't put pants on. It hurts your knee. That's a leaky gut. And food's moving through there. That whole bolus of food is moving through the gut. It's irritating. And it can activate an immune response to protect you, causing some swelling and inflammation. So get gelatin tannate in there to seal on the leaky gut, and then the tissue reproduces much quicker. Next, when you're shopping, Buy 15, 20 apples, always organic, especially apples because they're at the top of the dirty dozen of too many chemicals, right? And wash them, but don't peel them. And dice them up, get the seeds out of there, dice them up, put them in a pot, and if the apples are this high in the pot, add water to 1/3 the height of the apple, of the pot of apples. Throw a little cinnamon in there, maybe a couple of raisins, turn it on high. In 15 minutes, you got applesauce. My wife likes to put it in the blender. I don't. I like it chunky. But if she gets her hands on it, it goes through the blender first. And you have a tablespoon a day of applesauce. Why? Applesauce is high in pectin. Arguably, the most important enzyme for a healthy gut is intestinal alkaline phosphatase. IAP reduces endotoxin getting through leaky gut by 74%, reduces high cholesterol, reduces high triglyceride, reduces insulin resistance, stabilizing insulin sensitivity, and it binds to LPS to escort it out. So you want IAP. IAP thrives on pectin. So you want to give a little pectin every day. See, when I sign books, I've got a book signing in a little bit. I always write the same thing. Base hits win the ball game. Everybody wants the home run. We want, I lost 20 pounds.
Base at a time.
Base hits. It's the little things you do accumulatively
Singles
over
and
time.
doubles.
Yeah, right, right. It's the little things you do. So these are the little things you do to rebuild a healthy microbiome when you put them on a gluten-free diet. And if you don't have this kind of focus and whatever other tools you have to rebuild a microbiome, but if you're not focused on rebuilding a microbiome and letting them eat gluten-free crap, the result is 86% increased risk of mortality from a cardiovascular incident in the first year, and 3.87-fold increased risk of mortality from cancer in the first year after diagnosis.
Horrible. Horrible. But the news that you gave us are really important.
Yeah, it
and
is.
I can't thank you enough for sharing it with us, because I think all of us should know what to do. I mean, gluten-free diets are gluten-free diets, but you're teaching us how to protect ourselves. And I can't thank you enough for sharing all this information with us.
Thank you. It's a pleasure.
Thank you.
It's really enjoyable because I'm hoping you guys hear this and you say, wow.
I think they will. I think they do.
I'd like to look into that a little bit more. Great.
Thank you.
Thank you.